Welcome to this session that I think is the last one of this pipeline today. So thank you very much for being here. My name is Zaira Garcia. I'm part of the Vircel team. The original speaker of this talk was Joaquin Ortiz, that is part of my team. So I hope I will be able to do as good as he could do the same session. And what I would like to do today is to discuss a little bit more about what are the clinical evidence that we have that can support our test for detecting galactomannan antigen. Again, thank you very much for being here. And I will try to do everything in 15 minutes. And probably by the end of the session, we will have like 5 minutes for Q&A. But if we don't have time for Q&A, you are also welcome to come to our booth. That is 80. It's just across the corridor, so you just need to go there, and you will be able to find out more. So I will start with the session. I think this is a common situation in a hospital, that we can have a patient that is in the ICU, is suffering. Maybe that person has fever, is on mechanical ventilation. There are a lot of things that are happening to that patient, and the clinician needs like really extra fast results. And sometimes those results can mean life or death. So this is something that is very important. And usually what happens is that clinician will send some samples to the lab, and they will ask for an antigen for galactomannan, for aspergillosis. And the lab will say, I'm sorry, I cannot run this test today because we only run aspergillosis or aspergillus 2 or 3 times per week, and it's not today. I cannot. I don't have anybody that can run this test. So it's something that is critical. What do we know about invasive aspergillosis? Invasive aspergillosis is caused by a fungi that is called aspergillus, and it's a life-threatening disease that can cause like 30 to 50% deaths. This is something that is really critical. And this is especially important for some specific patients, as oncohematologic patients or patients that are immunosuppressed or immunocompromised. And also those patients that maybe are treated with corticoids. Again, corticoids will suppress your immune system, so you cannot respond to the invasion that you have. Why this is important? Because as we mentioned in the beginning, early diagnosis is critical. If we can diagnose that patient early enough, then the treatment can be successful. Otherwise, we can have something that is not good. If we think about the diagnostic methods that can be used for this specific disease, is mainly clinical findings. So fever, problems with the breathing, all these kind of things. Also, we have radiological methods, so we can do like radios from your lungs to see how things are going. And of course, we also have some labs methods that can include culture, PCR, and then we can have also serology. And if we think about serology, there are different markers that can be used, and one of them that is really specific is galactomannan, detecting the antigen against the galactomannan. And this is what I would like to discuss a little bit more today with you. So galactomannan, it's something that is expressed outside of the fungi, and then we can detect those things. Usually, what is used, and we have been discussing this in the first slide, the gold standard for detecting this antigen is ELISA techniques. What is the problem with it? Not the problem, but what is the challenge with ELISA? That is a technique that needs to be run like in batches in order to be able to process enough samples, to have time, etc. However, it has been the gold standard for more than 20 years. This is an assay that has been in the market for a really long time. Now, there are some alternatives that we can share with you. What we can offer from Vircel is our VirCLIA assay to detect the same antigen. And indeed, the technology that is behind our assay and also the ELISA is quite similar. But what we can offer is a monotest. Instead of having to batch different samples, you can run one patient. So if you have a patient that is critical and you want to know the result, you can run this. Also, we have like shorter incubation times and everything. What we'll do is shorten the time to be able to treat your patient. Something that is also important is this monotest. And you will see in the next slides, like how all those things, I can go back if you want to take a picture, no worries. Yeah, here. Also, something that is very important, that is a different if you compare versus ELISA, is that everything is included. In our mono test, you have all the calibrators, positive control, negative control, all in one single strip. And it means that you will not need like extra effort, extra reagents, extra technicians that need to be doing different things. If we think about that, if we have like a fair comparison one-to-one, what we can offer is like, let's say like small mini ELISAs where you can run one single patient instead of just batching everything. Of course, there are other options. Maybe if you want to run only like one patient that is using rapid test, but again, maybe sensitivity, hands-on, that maybe you need to run those samples can be a little bit different. So also with this kind of approach, some challenges can arise. Also, if you have, instead of one patient, more patients, this can be also like a small problem. This is great, but also something that I think it's important is how you can automate all these things. So what we can offer is not only the assay, but it's also all the automation that needs to be behind. And this is also something critical, because if you have a test that is quite easy to use, but then you need a technician that needs to be there, then the system is not that flexible, because those patients that are waiting for the result, they are not working there from 8 to 5. Maybe they are at night, when you don't have like specialized technicians that can run the test. So what we can offer is what you can see here in the slide is the full automated system. It's a system that will allow you to run those patients whenever you need to run them. And also something that is important is that now we are discussing about aspergillus, but maybe you don't need automation only for aspergillus. It's something that you can tell me. What I can tell you is that with our portfolio, we can offer up to almost 100 different tests. Again, this is something that we can discuss further in our booth if you want, but it's something that is important because you can consolidate. So you don't have a system there only for those emergencies. You might have a system that can help you just putting together different things in your routine. As I mentioned, the BioRat assay has been the gold standard since almost 20 or more than 20 years ago. So what we did when we started launching this assay almost 10 years ago was a validation, internal and external validation versus this gold standard. And what you can see here in the slide is that either with positive or negative samples, we have a really good sensitivity and also a really good specificity versus the gold standard. And this is important because it means that maybe ELISA is the common test because it has been there since ever, but maybe there are new alternatives that can be seen as the next gold standard in the future. What I would like to do now in the next minutes is to give you an overview of some of those publications, studies, evaluations that can support that we can offer a solution that is at least as good as ELISA and can be the next decision for you. So as I mentioned, we have already a lot of publications that can support our results. You can see here that almost you don't read anything, but I also welcome you to visit our website, invircell.com, and there you will find a very specific section that is only dedicated to the bibliography, because we really believe that if you have an assay, you need to have all the evidence to support the assay and what we can offer with the assay. So you can see here that there are a lot. I will not focus on 56 different publications. We chose like the most relevant publications to support the results of our assay. So the first one that I would like to discuss is one that was done almost like 4 years ago, where we were comparing, this is an internal study from our company, where we compare our assay, our Birklia Aspergillus galactomannan antigen versus BioRat. And as you can see here, the sensitivity of our assay is really amazing. So if you think about like from those samples that we tested, with BioRat, we got a sensitivity of 63% versus almost 81% from our side. So this means that this is something that can really work in your labs and for your clinicians. The next one that I would like to discuss was published a little bit later, like 2 years ago. In this one, we were not doing this internally. This is a real-life example where we were collecting samples, which you can see here, 535 samples from different patients. And of course, those samples were collected like in consequent approaches. So this is like the way we should be missing all these things. And also those patients had all the clinical findings, let's say, to be a positive case of invasive aspergillosis. And as you can see here, the sensitivity that we got is 100%. It means that all the samples that were positive with our assay. That again is supporting that you can use this assay as an alternative of the ELISA assay. Another one that I would like to discuss or I would like to share with you is another study that was published also in 2024. This is a retrospective study. I'm not going into all the details from the different publications, but the type of samples that were used in each of those studies can be a little bit different. Again, I'm happy to share more details back in our booth. So if you are interested, you can come there. In this case, we were comparing not only our assay versus Bio-Rad, but also some of other competitors that are in the market. For instance, the ELISA from Euroimmune. So we were comparing all these different assays. And what you can see here is that the sensitivity of our assay was the best if you compare Bio-Rad, Euroimmune, and our assay. The next one that I would like to discuss is another study that was done back in 2023. It was done in different labs or in different hospitals in the Benelux area, where they were using, instead of other respiratory samples, they were using main BAL. And they were also comparing Bio-Rad together with our assay, with our VIR-CLIA. And in this case, again, we had a quite large cohort, more than 100 samples, 144 samples. And what we got, again, was a sensitivity really high, above 60%. That, again, is quite good and quite high for this kind of assays. And the last one that I would like to discuss before we share some unpublished results is one publication that was done last year in 2025, where they were also, it was like a parallel study versus the previous one, where they were comparing serum samples, also in some hospitals in the Benelux area, with a quite large cohort, more than 300 patients. And in this case, we also got like a similar sensitivity versus ELISA. Again, you will see that numbers sometimes are a little bit different, but also because type of patient is a little bit different, sample types that are included in all these assays, in all these publications are a little bit different. And sensitivity and specificity can be a little bit different from BAL to serum and other samples. The last one that I would like to share with you is still not published. Those are preliminary results. And I think this one is really interesting because we were mentioning in the beginning that one of the main differences between our technology and ELISA can be in shortened times. So you can have results earlier, so you can treat the patient earlier. So what they are doing in this one is comparing Bio-Rad as a reference. In this case, the cohort, as you can see, is a little bit smaller, only 33 patients. But you can see here, and this is what I would like to highlight, is the time that you need to complete ELISA if you are using Bio-Rad versus the time that you need to complete the same assay if you are using VIR-CLIA. And you can see here that you can move from 121 hours, that if you do the math, it's almost like 7 days, versus 26 hours, that it means that you can deliver results same day. Again, delivering results is not only delivering results, it means that the patient will get the right treatment for that specific disease. And up to here, I've been sharing results that have been published, but also I think it's important to understand how quality controls are done. So I would like to share a couple of examples, one coming from CAP, and the other one coming from UK NACAS, where you will see that Vircel is already showing there. So we are the main partners offering this kind of solution. So if you take a look here in the CAP, you can see that there are a lot of responders. In total, 115 plus 11 plus 11. I didn't do the math, but let's say 130, sorry. And you can see that most of those responders are still using ELISA. And of course, they are still using ELISA because ELISA and this test from Bio-Rad is an old one that has been in the market for a really long time. But you can see that Vircell, that has been in the market less than 10 years, is already second. And then you don't have anything below. Below is others. Like the rest of the technologies, the rest of the competitors, they are not like this close because not so many places are using other different technologies. And then the last one, as I mentioned, is from the UK NECAS. And in this case, we had, not we, but the system, had almost 50 participants. And you can see here that almost 30% of those users are already using our technology, our BCLIA assay. It means that we are moving forward, and we hope to be the same as Bio-Rad, and of course, better than them. I would like to finish my presentation with a brief summary of everything that we have been discussing. And I think it's important to understand like two different points of views. We are thinking about what are the benefits for the lab, but also what are the benefits for the patient. So I will just go all of them, all together. But first, we have seen that we can deliver results same day. That makes a big difference, especially for the patient, and also can help the lab to organize in a better way the way they can produce results, the way they can process all those samples. They will not need batching. They will be able to do other things. Also, if you remember about the automation, this is random access, continuous loading. It means that it doesn't matter if you are running other assays, you will be able also to process your galactomannan at the same time. As I mentioned, we include all the calibrators, all the controls, everything is included in the same strip, so you don't need like extra things for the assay. And of course, I guess this is like the definitive solution for urgent samples. We have been discussing about aspergillosis, but you can think about other diseases that maybe could be also solved or tested using this system. And then if we think about the patient, I think this is the most critical, and we are all potential patients that can have an infection, and we could be in the hospital, and we would like to have like the best technology to deliver our results and to guarantee that we will get the best treatment. So again, if we can deliver results faster, it means faster treatment. It means that right treatment, appropriate, in the right way. And of course, we will be able, because this is something that you can run day after day, you can follow up your patients. And I would like to end the presentation as we started, thinking about the patient. Most probably, most of you are working in the lab, but maybe we have some clinicians in our audience. So you will see that patients sometimes are like, no, it's not only a tube. There is someone that is behind that tube that maybe is my mom or my son or someone like that. And that's all from my side. Thank you very much for being here with us. And as I mentioned, if there is any question, I will be happy to take maybe 1 or 2 questions. But if we don't have time, please feel free to visit us at booth 80. Thank you very much. Don't be shy. I can be shy, but you cannot be shy. I said don't be shy, but I didn't mean that you can ask. Please, easy question.
It is an easy question. So with galactomannan, it's always really important to balance the cutoff with respect to sensitivity and specificity. Now you said most of your presentation, you addressed sensitivity and the ASM quality control. You had 90% sensitivity. Can you explain what's the difference between the quality control panel and the studies?
I don't know if I really got your question. And
it was just that the sensitivity on the studies was comparable or higher to the Bio-Rad assay, but in the QC panel, it was lower.
And the question is, sorry?
It was lower. It was 90% where the Bio-Rad came out as 100.
Yeah, but I think it's also important to remember that depending on the publication, that all the publications that we have shared, we have different sample types. We have different sample types. So again, sometimes results can be a little bit different depending on the sample type that you are testing. Again, for us, but also for the ELISA. So sometimes you can have differences because of those type of things. Also, depending if you are thinking about patients that are proven to have invasive aspergillosis, or if you have probable patients or patients that maybe you don't know enough about them. So if we don't have any further questions, I would like just to say thank you again and hope to see you there. Thank you.